Good evening, everyone, and thank you for tuning into this session today. Today, we are doing our final session of our NEET PG prep series. This series was started in April, where we wanted to cover about 8 important subject areas for your NEET PG preparation. Now, during this series, we have learned how important it is to build a very strong foundation in order to crack not just your NEET PG exam, but to also work towards making your university exams properly. And today, in our final allotment, we have Dr. S. Chand with us. Dr. Chand is the author of the Medicine for Textbook of Essentials Textbook of Forensic Medicine and Toxicology. Sir is from Maulana Azad Medical College and has been associated with LNJP and GB Pant Hospitals, Delhi. He began his career in 2013 as assistant professor in Rama Medical College, Pelakua, Hapur, UP. Today, he is working as a professor and head of Department of Forensic Medicine and Toxicology at Teerthanker, Mahaveer Medical College and Research Center, Moradabad. Sir, it is great to have you today with us. Like you have motivated, inspired so many students and help them understand basic concepts of this subject. We hope that we can achieve the same during this session. Sir, to start off this session, my first question would be, if you can talk about important topics that students should focus on for NEET PG exams.
Good evening. As you have asked the question, which topic should be covered? Although the question has been asked from every topic in forensic medicine, but I would like to suggest that you go through topics like identification, sexual offences, these main 5 topics. You should go through these. And I would like to suggest also that at the end of these topics, there are some MCQs. You must go through these MCQs and practice on daily basis, right? It's not that the question asked from the topic, because questions numbers asked in the exam, they are very few in the subject of forensic medicine, right? Next question, please. Next question, please.
Yes, sir. Sorry. So I was on mute. Sir, forensic medicine is part of our third MBBS curriculum. And could you please provide some guidance on how to prepare for this subject from both the third year's MBBS Part 1 theory exam and also from NEET PG perspective?
Okay. Actually, these two things are different. Preparation for third MBBS part theory exam is different, and preparation for UP is different, right? As far as third MBBS part 1 theory exam, I would like to suggest that preparation is not at that or before the time of exam, but it is from the beginning of third MBBS one. I will tell you some rules. From rule 1. Rule 1 means whenever you go to class, means students, then in the lecture theatre, they should be focused on the topic there, and they should try to learn and remember everything. Now I would like to suggest rule number 2. After lecture class, what should we do? We should try to cover that topic or revise topic again within 24 hours. Right? It is much on to this time, more chance to get to forget. Right? Rule 3, I would like to suggest what to do during exam days. Most of the students, they don't know the what and should be sleep complete before the exam. You can say 6 to 8 hours, right? But many times it is said don't sleep in the night. They keep doing study morning. Obviously, their mind is hanged, right? In my terms, I would like to say that mind must not be hanged. It should be clear. So before exam, you must take proper sleep. Because if you don't take sleep, your mind is hanged and you can't remember, you can't memorize those in the past, right? If student study in the night, even that, the student liquids in the form of water, glucose water, tea, coffee regularly, right? And they should take frequent rest, right? And it's better if they study with discussion, right? And in the morning, on the day of exam, we means students should have brisk wash for at least 10 minutes early in the morning, right? And for breakfast, it's very important. I realized that in the breakfast, there are parathe, there are biryanis. I would like to suggest that before exam, you must take some protein diet, light diet. For example, you can take apple, bananas, or some other light things, eggs, right? Number 4 is what should we do when we exam? You should be very relaxed, peaceful, calm. Take 5 deep breaths by having your eyes closed, and then you should have a smile because nothing is going to be lost. Then think and suggest yourself that I will be smart, I'm feeling fresh, confident, right? Actually, these are the root rules for the student, and they are not aware of these rules. Next question, please.
Sir, how to attempt these questions? You know, you've spoken about certain areas which students should prepare. How to attempt these questions effectively in examination?
Whenever you get the question paper, then you must prioritize the question, which question to attempt, but remain attempted in sequence. Because whenever examiner sits to check the question, check the paper, then he finds it to check. If questions are not in secret, right? It's very a simple thing. And never leave any question unattempted, right? Or blank at any cost. Write something related to the question. And when the question student has not attempted, it is certain that a student will get 0, right? If question is not attempted. But if something relevant has been explained or written in the exam in the answer, then there are more chances that student may get some marks. Many universities check the questions, check the exam. There we see this thing. The student which has never attempted to get give it zero, but the student who has written chances that we always give him some marks, right? Very important thing. You must attempt a question first of all in sequence. Every question should be uh, going right. Have it in a numbering 1, 2, or 3, or in bullet format, right? And writing should be neat and clean, right? In this answer, you can highlight the main headings also. Methods to get good marks, they are not those which the student think. Methods are something different, which I have told here. An examiner when sits to check, he sits peacefully, get irritated by the irrelevant ways what the student uh, do, right? Next question, please.
Sir, one important topic from exam perspective is how to determine if suspected case of poisoning should be classified as a medico-legal case. How do you make this determination?
Every case coming to a doctor in casualty or OPD, that is a medical case, right? Because it has the treatment, and after treatment, there is no issue. Patient arrived the doctor for his treatment, but sometimes the situation is different. Sometimes there is a doubt or suspicion which arises when the patient approaches the doctor, right? So doubt arises that something has happened to me, or are the more chances of commission of a crime. The doctor may label this case as medico-legal case, right? Because in this case, some legal disputes have been involved, right? So first scenario which there is a medical, but if they are involved, that is medical legal, and for to make ML medical legal case report, and they have to take consent, proper consent. Then we have to write identification marks, right? We have to examine it thoroughly. Then we have to write our opinion regarding this case. So this case may belong to any category, asphyxia, poisoning, injuries. The thing is that whenever this case approaches and doctor has some doubt or suspicion, that he must inform the police, because doctor's duty is to treat the patient related to the situation by the police, says to every citizen of India and as well as all doctors to inform police as early as possible in all medical legal cases, right? In this way, so a medical case from a medical case. I can't hear.
So is it better now? What key points should students focus on for toxicological emergencies and poisoning management, sir?
You know, when a poisoning case approaches the casualty, then we have two types of duties. One is medical duties, and medical duties. So medical duties involve the things, right, for which every doctor has been raised or has been prepared himself. But for medical legal case, every doctor has certain duties. Okay, so in those duties there are many formation of took place, right, for preservation of evidence. But here the question that is focused on toxicology emergencies and poisoning management. So here, what is good knowledge regarding the management? He should have good knowledge regarding different types of antidotes. He should related to the and he should know method of infusions, how the antidote that has to be given to the patient. He should know the gastric levels and uh, antidote uh, ingestion route. Right? He should know some other things related to that. How to manage the patient after treatment, miss follow up. These steps in which we have to. Okay.
Sir, from our side, some of those were the some of the questions that we had. Sir, again, if we just slightly try to focus back on our NEET PG preparation, now students get about 40 minutes to complete one section. So if they see a forensic medicine question, how do you think they should approach that question?
Actually, in the subject of forensic medicine, right, we can't neglect, very important. And we can get many books in which MCQs have been given. But I think MCQs given in textbook also in my own book even in the everywhere I have mentioned superscript Q. Superscript. It means that has been asked in the so a student can go through it seriously. Other thing is that at the end of each chapter there, there are some those points which have been asked exams which for these students undergoing the NEET UG exam. So they can go through those even. And also MCQs have been given. So the average student uh, should practice these questions on daily, then he can remember preparation of MCQs UG exam.
Sir, sir, if you can briefly talk a little bit about your book and how it is structured
Okay.
for the exams.
Actually, my book is Essentials of Forensic Medicine and Toxicology. Right? Case story as well as the practical aspects that covers all the competencies from FM 3.12, 3.14. Sorry, to 42. Okay. Theory part, some long questions have been given, some short notes have been given, difference between have been given, and sometimes little hard have been given. So the questions which have been asked in the exam, they have been provided, and if in these questions we have demarcated how are marked as 3 stars. Some questions have been marked as 2 stars. Some have been marked by 1 star. It means that questions which are 3 star exams right? The most important question is in that first 10 university, right? And I have seen that the questions which have been asked in the exams recently, they have been taken from these stars. From so it is important for us that university exams which that university is going to conduct, that takes such type of questions which have been given in this book, and they have been marked stars.
Yeah.
And like, right, little heart which I have mentioned in my book. Little heart means a small topic which is not mentioned or which is not elaborated in the textbooks. But here I have elaborated with some description. There are more chances that they could be on the exam, because in the exam 90 questions are almost, they are actually kept easy, but percent questions they may be asked from these little hearts, right? And for the practical exam, I have to each competencies, right? So at the time of practical examination, a student can go through these competencies and he can prepare viva from these uh, questions given at the end of each competencies, right? Even if I have given this viva, grand viva in toxicology, the grand viva of the book, right? And in the starting of the book, I have provided one page in which secret of success has, in this success I have given, which I already mentioned here, how to go to the exam and how to perform there, right? And also I have mentioned here a take. So obviously every student wants a textbook which he should do minimum effort, but the student should get maximum marks. It is books should be, it should be easy language, relevant and fully updated knowledge. It should have question and answers. It should be interesting, right? So almost these points, they are uh, they are right.
Sir, that was all from our side. I hope all of you were able to gain something out of it. I know there were some problem with the network. I think there was also some connection issues. We apologize for those technical problems. A recording of this will be available, and You can get Sir's book from All India Book House. They are currently running a Elsevier specific discount, and that discount would so please that discount is available on their website. So please use the platform, use this opportunity to get the book for yourself. That is all from our side. I hope this was useful, and we will come back again with another series for you. Thank you so much.
Thank
Thank
you.
you so much, sir. And it was good to have you. And we'll see you again. Thank you.
Thank you.